Welcome, everybody, to this discussion on the science policy interface. My name is Claire Dool and I'm your moderator. Well, I think we'd all agree that COVID-19 has been a wake-up call and shown us all the important role of science and scientists in supporting policymakers and politicians in making the right decisions for society during a health crisis. In a recent interview on the BBC, the former head of the UK Vaccine Task Force, Kate Bingham, said, "Before the pandemic, science wasn't included in any way in policymaking," something she said she changed while she was in charge of procuring the first COVID vaccines. Science, she said, should be included in policy decision-making, just like economics. Well, we're going to need much more of what is known as this science policy interface, as by all accounts, the climate crisis is going to be much more complex to manage than the pandemic. In our discussion, we're going to look at lessons learned from the pandemic, where the gaps are, and the lessons to be applied to the climate emergency. We're going to hear from experts in their field. Beata Janowczyk, head of the Risk Assessment and Emergency Planning Unit at the Polish government's Centre for Security. Professor Virginia Murray, head of Global Disaster Risk Reduction at the UK Health Security Agency. Tom de Greve, deputy head of the Disaster Risk Management Unit at the European Commission's Joint Research Centre. Jürgen Spaaf, coordinator on the European Science and Technology Advisory Group for Evidence-Based Policy and Professor of Sociology at the Mid-Sweden University. And Julien Pain, Editor-in-Chief and presenter of the weekly fact-checking programme Vrai ou Fake, broadcast on the French news channel France Info. We'd also very much like to hear from you, so do ask your questions using the Q&A function. And of course, tweet using hashtag EFDRR2021. Now, this panel was organized by the Government of Poland and the CIMA Research Foundation, a non-profit organization committed to the promotion and support of scientific research, technological development and training in the fields of civil protection, disaster risk reduction and biodiversity. So it's my real pleasure to give the floor to Marco Massabo, the Programme Director for Capacity and Disaster Risk Reduction at the CIMA Foundation, to give his opening remarks.
Thank you, Claire, very much. It is difficult to add something to your initial presentation on why science and policy are so important for our society. Definitely, the science and policy interface is not coming on the scene today, especially in Europe, as country organization. They are trying to make better use of science for many years on, and we have very good practice in that. We have advancement at the country level and the European organizations, like the JRC, but other organizations are also leading this. The Sendai framework is a strong component of risk understanding, and of course, the risk knowledge. And this one has brought to the agenda of EFDRR for many years. But maybe one of the questions that we can ask is why now we are going to bring the science and policy interface? Well, you mentioned that, and I want to remark that some of the research that were done in CIMA, there is a stronger relationship between new legislation and civil protection and major disaster. New legislation usually bring an innovative way of doing disaster risk management in the countries. And this one has unfortunately, major disaster has been also unfortunately a driver of change. If we think of the European legislation Seveso, is even the name coming from a major disaster that we had. The flood directive itself, it came after a big flood disaster in the Central Europe. And there are all of these examples that we have studied in CIMA. So why we should now put the science and policy interface now on the scene is because we should use the momentum of the changes that are going to be made during this pandemic, which is unfortunately not terminated yet. During the COVID, definitely has the science and policy interface has been shown that there is no linear interface, linear transfer from the science community to the policy community, but this interaction is much more complex. Scientists were used to just produce the knowledge to inform the decision maker, but science, we see that this one needs to be reformulated from and behind of the scene advisory role for the scientists to a more active role in the overall decision-making process. We've seen during the pandemic, scientific committee coming up to say what is the status of the infection and informing the policymaker, but same has been a different structure. So one of the topics that I think this session will inform us is how the different organization and establish this mechanism of cooperation between scientists, policymaker, but the entire society as well. The second point I think that I just want to make is how the science and tools that are available, so satellite data, new prediction model, or artificial intelligence can be used to generate evidence-based solution from a need from the policy on the action. So how those new data and information can respond to the action and the policy need we need to request. I mean, we are in a world of change, so climate change, you mentioned that, but also we have a lot of social change. If I think my place where I live, the average age is 48 years old. So I'm glad I'm still in the young part of for a couple of years. But this one, a huge societal change that we are facing. And what science will help to address all these interaction between disaster and this climate and societal change that we are going to make. So I hope, I think I put some of the food for thought of this session on why we are putting science and policy interface so much in this session, because we need evidence and we need to use this time to make the change in that direction. Thank you, Claire.
Thank you, Marco. And I know that you're going to come back at the end and you're going to summarize some of the key points. And we will certainly be talking about some of the technological innovations. Of course, we know it's going to be all about societal behavioral change as well. And of course, trying to institutionalize this relationship between the scientists and the policymakers, which, as you say, is not linear and can be quite complex. So Marco, we look forward to hearing from you at the end of this discussion as well. Well, to begin, just a very small scene setter to know, well, where are we? What is the state of the science policy interface? And Jürgen Spath, Jürgen, you've done some research for the UN DRR regional assessment report on the status of disaster risk reduction in Europe and Central Asia. So can you briefly tell us your findings on the state of this relationship between science and policy?
Indeed, I will, Claire. Thank you very much. So this is an endeavor conducted by the European Science and Technology Advisory Group of the UN office. And we reviewed 15 countries in Europe and Central Asia to look at the status and make an assessment of where we are in terms of science policy interface in DRR in those countries. So we had appointed country experts providing country reports, and then we wrote a consolidated report, both on the policy processes in general and in DRR, and then how is research in this field funded, so the creation of scientific knowledge, and then finally the transfer of scientific knowledge, so really that interface. I should probably start and say that this policy field, DRR, as a policy field, is quite young. We have been dealing with disasters for centuries, but as a policy field specific, it's quite young, roughly 20 years. So even if we have some documents from 1960s and onwards, they are very rare. Almost all of them come from this decade. Now, despite this short period, there has been a tremendous development of the policy field and in many countries, but in very different pace, I would say. So when we analyzed the results, we could see two major, say, groups of countries. There is northern countries that tend to have dedicated national agencies for DRR that bring together the relevant authorities and stakeholders for specific issues. In the southern countries and also further east, they exhibit a more traditional hierarchical organization with substantive involvement by political institutions such as ministries and civil protection agencies. And I think it's important to be aware of these differences throughout a region like Europe and Central Asia, because if you try to implement some sort of best practice or some paradigm, ways of thinking, we have to acknowledge the vast differences in the different parts. So the southern eastern group of countries, they are political, driven by the national government, political parties, etc. So very much more politicized processes, which is not a bad thing. It can be very quick when it comes to agenda setting in policy making, very quick decision making, for instance, and consideration of these different policy options. The Nordic Western countries, on the other hand, might be more efficient or effective when it comes to implementing and evaluating different policies, because all stakeholders have already been involved. So that is one of the major findings, I think, and I don't have time to go into details, but you can surely read the paper once the regional assessment report is out. And I'll leave over to you there, Claire. Thank you.
That is really interesting, Jürgen, what you say in this different approach between the Nordic and Western European countries and those in the South and in Eastern Europe. Beata, I should really bring you in here because what Jürgen is saying is that the processes are more hierarchical, which is good at the beginning, but perhaps when you're wanting to implement, it's better if you have a more inclusive process. Beata, it would be really good to get your view on what Jürgen has just said, as you are representing Poland in this discussion.
Yeah, we have a lot of experience because I'm sure that the pandemic clearly has shown how important is, on the one hand, the cross-sectoral cooperation, and also has stressed and how significant is the need to tighten the cooperation between the world of science and the decision makers. And at the beginning of the COVID-19 pandemic, Government Center for Security, which I represent, with scientists from Research and Development Institution, created a data integration platform using geographic information system software for crisis management units involved in the fighting against the COVID-19 pandemic. And what is important, it aims at, on the one hand, to provide support for decision-making process, and also to provide the state services with the necessary data related to the epidemiological situation, but on the other hand, to provide the public with access to an up-to-date map of coronavirus infection and also information of a vaccination process, and published it on the governmental websites. And the next example of our cooperation is the work done on the prognostic model of coronavirus spreading in Poland. Together with our colleagues from the Mathematical and Computer Modeling Center of the University of Warsaw, we have implemented data into practice. On the one side, the questions were asked, for example, what happened if we would open the schools, or we close the shopping center, and the model is giving us the answer. Eventually, the model created with scientists is giving us the tool to make decisions or introducing or limiting the restriction. Thank you very much.
So Beate, you've got a tool there. How did you find it, the inclusive process? For example, working with mathematicians, as you said, from the University of Warsaw. Did you work with other types of experts cross-sectorally when you were developing it?
This is an issue to create cross-sectoral cooperation. On the other hand, we had representatives from another ministries, voivodeship offices. This is our authority in regional. So we have a lot of other institutions, and to take into the consideration our cooperation with scientists, we have also a Space Research Center for Polish Academy of Sciences. So we are, it's the truth that only cooperation across sectoral will give us a solution, yes, to find gains, not only the pandemic, but only for or other hazards.
Tom, the name of your organization, Joint Research Center, says that you're used to cooperation. But I'm wondering, COVID, of course, you know, the biggest thing to hit the world, possibly since the Spanish flu, you would know better than I would. But what did you really learn about the need to be inclusive in the processes during COVID? How did you manage that?
Yes, yes, indeed. The Joint Research Center is, for us, science policy is our business. No? It's a research organization that is part of a political organization, which is the European Commission. So we do both science and deliver it always in the political process. So it's very important. And COVID was a big test and an opportunity to perform well. So I had the privilege of leading the task force for COVID, of co-leading this in the JRC. And what this means is the JRC does research in almost all the fields. And what started as a health crisis, or even because it was managed in our unit as a disaster that was far away and could possibly threaten Europe, soon became an all-encompassing crisis. And it was very important to tie together all the scientific disciplines. So inclusiveness in disciplines was crucial, because then you can also provide advice to different sectors in the government in a much more coherent way. Different disciplines, economists advise economic departments, health specialists advise health policy experts. But by tying it in at scientific level, already the advice can be much more coherent, more impactful, and also more anticipatory, because you link things beforehand and you can be much more forward-looking there. Now, the challenge was that we had to set this all up during the crisis, because it was very new. There were new connections to be made between the health sector and the disaster sector, between economists who model in quarters and health specialists who model by days, and the things needed to be connected. Also other partners outside, of course, other scientific organizations, agencies, member states, local organizations. Many of these relations needed to be established. Now, if we have one lesson learned, is that this would be better to institutionalize this beforehand, no? To have an effective science policy interface where the partners know each other, the bridges have been built beforehand in peacetime, so that you can use this very much when the crisis is there. And that is actually what we have been trying to do since the Sendai framework. Basically, in 2015, we immediately started to look at how we can build a knowledge center around disaster risk connecting various partners into a center of knowledge where these bridges are built. And just recently, all this effort that we tried to do the past 5 years for the Disaster Risk Management Knowledge Center paid off into an institutionalization of this in the legislation of Europe, an implementing act establishing a knowledge network, very much requested by member states to have this a bit more formal and established there. So we're very, very happy with the evolution of the science policy interface in the past few years, leading up to next week, the launch really of the knowledge network, of which now we will manage the science pillar to bring the science in there.
So I'm interested, you've got this cast of characters, you've got economists, social scientists, crisis managers, epidemiologists. How do you get all of these people to work together and to be coherent? Because they come from different disciplines, perhaps they've got different timelines. What were some of the things that you had to take into consideration?
Well, it is transdisciplinary work is very relies on understanding each other's worlds and taxonomies and how we call things and the data we're using. So definitely there's a lot of, it's important to work together on topics before the crisis happened, so that you are practiced in doing this. It's an effort, but it pays off for sure. But it's also very, very important to have the links to the policymakers and to have the understanding the needs from the different departments, and facilitate this also at the level of policy making, that there is an understanding of what comes from one sector in the other sector. So the dialogue is very important, that keeping the dialogue ongoing. And last week, for instance, we had the 5th annual seminar of our Disaster Risk Management Knowledge Center, where we had this dialogue. We talked about it in depth, about building scenarios together that are interdisciplinary, intersectoral, about understanding the goals for resilience, because in the EU now there's an intention to set disaster resilience goals, a level to which we all want to be resilient to. And this dialogue is so important between the different disciplines and the different sectors.
I'm just wondering, you've got all of these different people from all these different sectors, and you're saying that you're wanting them to talk with coherence, because obviously that's going to have more credibility with the policymakers. But what happens, I mean, just thinking about what Beate said earlier, what happens when you say the economists are saying, we've got the models which say that you have to keep the economy open, and the epidemiologists are saying, well, we've got the models that show you've got to lock down. And who makes that decision? Yes.
Well, at scientific level, it is of understanding each other's world, no? This is a particular study we did actually in the JRC that was to bring all the modelers together and to have the confrontation at scientific level of what it means to lock down. What does it mean? Why do you lock down? For the health reasons, and what are the impacts in that sector? But what does it mean in different economies? And we had experts from tourism, from mobility, from all kinds of areas working at the regional and national level. And it was a bit of working together, no? Before we could confidently say that one model could feed in the next and inform for instance, the assumptions that the economists could make on how long the lockdown would last, etc. No, definitely there's a lot of learning that needs to happen. But for that, for instance, it is important to bring the people together in kind of a synthesis of knowledge beforehand. And that's what we also tried in the past 5 years. We published 2 books on disaster risk management, and they're available now in the Knowledge Center, where we brought already together people from different sectors, but really in peacetime, trying to understand the issues, write about it, identifying the challenges for different sectors. What are the challenges for scientists? What are the challenges for practitioners? What are the challenges for policymakers? And basically coming to an agenda of what we know and what needs to be done. So this is a big contribution, I think, for all sectors, because it's written so that experts in economy could read what's happening in the other disciplines in an accessible way, and the other way around, no, between all the scientific disciplines.
Virginia, let's bring you into the discussion. We're hearing a lot about the importance of inclusion, cross-sectorial, so that people can build a credible case to the policy makers. What do you see as the main barriers which, are preventing a stronger use of scientific findings for policy making?
I think because we need to speak the same language. And I think, Tom, you have articulated it really well, and so did Beata. It can work really well if you can, but if you just think about it, we know that in a crisis, facts are uncertain, values can be in dispute, the stakes are very high, and the decisions are urgent. And this very strong message that comes from the International Network for Government Science Advice really focuses on how we can build the science to be much more effective earlier. Tom, one of the things that you raised was that advice in emergencies is different to how we give normal advice. I mean, we would regard normal advice as technical, regulatory, or deliberatively informal. And I know the JRC does a huge amount of this, and it does it in many different areas. And I think it's been incredibly valuable. But it's trying to bring that together to try and make sure that advice in emergencies really works. It's that growing partnership, that growing knowledge of what needs to be done. And another thing you mentioned, Tom, that I thought was so valuable is that we need to understand each other's languages. And that's something that's come through really strongly in the work that we've been doing with UN, DRR and the International Science Council, and with many UN partners and many science networks and other groups to try and agree a hazard list. What are the hazards we need to be ready for? And that's been a massive effort, which has sprung very much from the Sendai Framework Monitor work, but also the understanding of how we build this. And the European community and the European countries and others have been much engaged in this work in helping us to deliver this. So we now know that we need standard definitions for meteorological and hydrological events, extraterrestrial hazards, geohazards, environmental hazards, chemical hazards, technological hazards, even biological hazards. Biological hazards are now seen because of COVID-19 to be really at the heart of trying to understand so many of these different issues of epidemics and pandemics. And even though not in the Sendai framework, for completeness, societal hazards have been included. So these standard definitions that were published by UNDRR and the International Science Council in October this year are very much a way of trying to test how we can implement these definitions in a way that will help countries to understand what the impact might be for Sendai framework monitor reporting, but also for national risk registers and national and local risk understanding. And that way, I think we will be in a much better position to understand what might work. And it's that incredible partnership that scientists have to respond to what policymakers need to see if we can deliver things more effectively. And it's always that listening, that sharing, that learning that Beata and Tom have pulled together so clearly.
I'm just wondering, Virginia, I mean, is there a particular timing when it's important to give that information to a policy maker or to a politician when they're more receptive than other times? Are there some tricks of the trade that you can share?
Well, one of the things that I'm very fond of in teaching our students, particularly, is we really feel that to be able to share knowledge and to be able to explain to people who have to make decisions, that one of the things that really helps is remember an elevator pitch. something you can share that would reflect their need that takes no more than perhaps 30 seconds, when you know that you have the evidence at your fingertips and you can provide something that's really going to help them to make the decisions, because scientists are not the decision makers. Our job is to provide the information to help to inform those decisions.
I'm just looking at Tom there, an elevator pitch. That's sort of my world, Tom, of sound bites. And I'm going to bring in Julian in a moment. I mean, can scientists communicate that clearly and concisely, as Virginia is suggesting?
I think we have to. It is absolutely essential now to not only communicate the science in scientific journals and to fellow scientists, but also bring it definitely in the science policy interface, turn it into narratives that are heard and understood by those that we want to speak to, those that need to listen, those for which we have a message. And for instance, in the JRC, this is now a priority to work on communication, to do visual analytics, to communicate in terms of stories, because the stories are so powerful with putting data into context, putting the scientific findings into the context of those we want to inform. And this is a crucial finding also of last week's seminar, and that will be brought forward in the knowledge network with member states to make sure that the information arrives where it should. Challenging, but definitely important to do.
Well, that's great that you've got a whole team on science communication, because indeed, I think, unfortunately, perhaps what we've seen is that, stories are perhaps more powerful than data with COVID. And if we think of the vaccine take-up, let me bring in Julian, who is a television presenter on France Info, just to reflect perhaps on COVID-19. How did you think the scientists communicated to the journalists? And then, of course, the journalists are the vector to communicate to society. But what was your assessment, Julian?
Well, it's important that journalists reflect on what happened in the pandemic, because obviously journalists made many mistakes, because it's probably, the scientific world is a world we didn't know very much. And most people I work with, they don't have a scientific background, which is a problem, I think, in newsroom. And we didn't really know how to address this new crisis. And I think so we couldn't talk about it in details, but we have a responsibility and we made many mistakes. But I think many scientists as well who came to us on TV made as well mistakes. And I think we maybe pushed them there because clearly on the television sets, you want to be clear, you want to be concise, you want to give explanations that everybody grasps in 5 minutes. And if people ask you a question, you want to answer by being, it's black or white. You want to answer clearly because you believe that's what the journalists expect and what the public expects, which is partly true, because as a journalist, you always prefer the person who says, yes, that's the answer, instead of someone saying, well, there are nuances and you can't say that, you have to, for a journalist, it's boring. And the mistake we made is that we invited mostly people who had clear answers to the question we had. And we realized later on that actually the people who had clear answers, they were probably the people we shouldn't have invited, because they were not specialists. Because I think from the very beginning, the real specialists, they knew that the problem was complex. They knew that they couldn't provide the answers we wanted. They knew that saying at the beginning of the crisis that the transmission of the virus, for example, was mostly on doorknobs or on things you touched, that they didn't have the elements, the scientific evidence of that. And you have people on my TV set who say that, clearly, like you have to wash your hand every 5 minutes. And if you do that, you're all right. And we all know now it's That was nonsense. So what I mean is, I think we made a mistake, and it's a collective mistake. Both the journalists, the way we interviewed people, because we didn't know how science progress, how science work, and the people who came to us and who, I think they took off their scientific hat and they became pseudo journalists, or they played the role that they believed we wanted them to play.
That's really interesting. And I would quite like to get some responses there. Perhaps, well, Virginia, Tom, Beata, there we are. You were becoming pseudo-journalists, pushed into a corner because journalists like black and white and don't do shades of grey. Virginia, your response.
I think scientists routinely do shades of grey. We're never certain, and certainly in a new pandemic, we would not be certain. But there are some advices that are very good for infection prevention and control, such as wearing face coverings, washing your hands, and not going out if you're ill, particularly if you have a temperature. There's some pretty straightforward messages that we would recommend for any infection. So I think that we obviously all started, and certainly I wasn't actually speaking to the media, it was many other colleagues. We felt it was very important to make sure we shared the evidence that we knew was as safe as we could, and then to refine it where we could. And I think that's something that comes through very clearly. And one of the things that I think's worked relatively well in the UK, and I know there have been many issues for us here, is that we've had a lot of engagement with our chief medical officer, who has spoken for the health science, but also with our government chief scientific advisor, who's spoken for the global science on many of the press conferences that have been run here, trying to share that information and that evidence, but also responding to questions not only from the public, but also from the media, wherever it can be done most effectively and usefully, but building that guidance step by step as the evidence and the knowledge about a new pandemic emerges. So it's been a challenge, as we all know. It's been a huge global pandemic with many impacts, but it's that sharing of evidence, working together, listening hard, learning, and trying to make sure that whatever we know is as accessible as it can be.
Beata, did you get the impression in Poland that some of the scientists were perhaps too black and white and not grey enough, as Julian says, in that they were too categorical in their beliefs rather than communicating uncertainty? Any thoughts on that, Beata, in Poland and what you observed?
I think that the pandemic is sending us a strong message. We do need a dialogue to make complex solutions. And for example, in Poland, we create our tools to share the data with science and development entities and have back analysis, forecasts, scenarios, also modeled by use of artificial intelligence. So we cooperate and we work together. And I think that this is very important to have one voice and to be close. And for example, in our system, which we created, those products are shared with entities responsible for crisis management and also civil protection, for analysis, for around-the-clock services, and also decision makers. And what is important, we are planning to use these new tools to collect the data on losses from disasters to fulfill implementation of the Sendai framework, but also to assess manage risk locally. And for example, as I mentioned before, in cooperation with Space Research Center for Polish Academy of Science, we are going to build a platform integrated different services in one place. For example, satellite imagery, data collected by drones, and also other maps, tools to improve our early warning systems and to build threat awareness among decision makers. So I'd like to give you another example, because, for example, we have a SMS system. This is SMS alert system created by Government Center for Security. It's our part of early warning system in Poland. And this message is sent to all people in danger area. Why this is example of cooperation? Because it has a solid foundation developed jointly with research and development entities in the field of threat monitoring and also population warning. And this is a good example of joint effort towards reducing disaster risk.
So we were talking about communication, and now you're talking about the tools that you've got there.
Yes, but these tools we can use for this. But for example, I think that very important is that the word of science meets government in Prime Minister Medical Council. This is our other tool which we use at the beginning, from the beginning of the COVID pandemic. We have a medical council, also we have a governmental crisis management team led by the Prime Minister, and we have also their representative of scientists. So this is other example. And I think that when scientists and policymakers speak a voice, one voice, this is also a way of fighting with disinformation.
I'm going to move to disinformation, and Julian, I'm going to come to you in a moment, but I want to bring Jürgen back into the conversation just to reflect on some of the things that he's heard. And we've heard a lot about the processes of being inclusive. We've heard a lot about the tools that are being developed, the data gaps that have been identified. Jürgen, do you think that this is enough to improve this science policy interface?
Oh my goodness, Claire, that's a hard question.
Well, you've got a big title as Professor of Sociology, so I thought that you most probably would be the one who could answer the big questions.
Absolutely, I'll give some input and to the discussion. I think all of these initiatives, for instance, by the JRC and other bodies are great. And these are ways forward, of course. But I think it's very important to have an understanding of there is no silver bullet. There is no one solution, magic, solution to a pandemic or to any kind of disaster. It's an ongoing process. And sometimes I feel that crisis management or disaster risk management is we are a bit stuck in that cyclical thinking, before, during, after thinking. One thing that the pandemic has shown us is that this is a very much longer event. It's a what we call a creeping crisis, which might call for a different way of approaching. Maybe we need to think more in a longer processual way, for instance. So that's one input. I also think that it all sounds great to have different disciplines coming together and agreeing on stuff, and that, in theory, that might work because whoever is involved might be ready to find a consensus. But we have to remember that the disciplines are very different in their conceptual understanding of certain terms, and I think Virginia's work on the hazards definitions is fantastic, but if you go beyond the terminology, the terms themselves, you can see that the theoretical underpinning might be very, very different. And just to mention one concept that Tom, you brought up is resilience, which is completely different in, say, structural engineering, economics, compared to anthropology or humanities. So even if we talk about certain words and we seem to agree, if we dig deeper, it might not be that easy. I want to bring in one last reflection also. That is, I've been involved in many studies comparing the response of the pandemic on national and local levels. And during the first 18 months, so 1.5 years, the number of publications in political science and public administration went from 1 in 2019 to over 2,000 in just 18 months. So that shows a bit of the power of interest that something like this can happen. Now, the problem is that who can say what is good and bad of that research, published research still? And also, when you want to turn it into action, well, how can you possibly condense that knowledge from 2,000 journal articles, probably 10,000 people, into something useful? It's a very big challenge, of course. So I think it's important to understand the politicization of evidence, because at the end of the day, like you said yourself, Claire, somebody needs to make a decision. Somebody needs to pick the evidence that suits the purpose. So we need to understand what these purposes are. Policymakers want evidence, but why is that? And how do they want it? For what purposes? Thanks.
That's interesting, and perhaps I'll get the thoughts of Virginia and then Tom on that. Jürgen is saying a different way of thinking, resilience, it's one of those buzzwords. It means different things to different people. And also he was talking about the politicization of evidence. Those were the points I picked up. But Virginia, if you'd like to respond to what Jürgen has said, and then Tom.
Jürgen, your points are very well made and very important to reflect on and understand further. And I think very, very valuable. Perhaps to me, one of the things that I think is increasingly important is how we train scientists to make sure that they have the opportunity to understand how their evidence and information could be used to try and facilitate the understanding of how we inform policy and practice. And I think that's something that's come through very much closely with the work of the International Network for Government Science Advice. Scientists are often knowledge generators, but they might need to be knowledge synthesizers. But our new role, which you're beginning to point to, Jürgen, is really as knowledge brokers, trying to make sure that we make knowledge accessible and understandable for many. And that is something that most of us, when we trained, was not something that was so apparent. And to me, perhaps one of the most exciting things that we have done was in the knowledge generation, synthesizing and broking is the vaccine work that has been undertaken in the UK and many places around the world to try and help reduce the impact of this particular pandemic. And we now know that over 7.5 billion, reported by WHO only yesterday, 7.5 billion just about vaccine doses have been administered across the world. So that is hugely reassuring and something that we're trying to do to deal with these things. But I just wanted to take you as a further thought a little bit, Claire, is to thinking about climate change and disaster risk reduction. What we know is the future for climate change and adaptation and climate change impacts is that we have no vaccine for that. We were very lucky to find a vaccine for COVID-19 and for other diseases, which we hope will help us to take things forward in the future. And I think it's this constant engagement with how we can learn and share the evidence most usefully, as you reflected, Jürgen, in all the different disciplines, all the different understanding of the languages of resilience itself will be really important as to how we can move forward. Thank you.
Tom, if you would like to respond to what Jürgen and Virginia have just said.
Absolutely, and thanks, Virginia, because I also really wanted to bring the discussion towards climate change and the future risks, because this will be a much bigger challenge than we now have for the COVID-19. Of course, this is the defining challenge of our generation now. Now, what I wanted to bring there in the context also of uncertainty and complexity and the role of us as communicators is the role of open data. Open data is so important to have the data collected in a coherent way, a robust way, and then make it available in a way that it can be used by not only the discipline you're working in, but also by other disciplines, describe it well enough and make it accessible enough. The scientists are not necessarily the ones that have to come on TV and explain everything, because there's always a partial view, but they should provide the data, they should provide the evidence in a way that is fair, not hiding complexity or uncertainty, but describing it well so that it can be understood by those that are better communicators. Open data is one, narratives are the others, and I come back to that. Our work on climate change, there was the PESETA 4 study, which has informed the adaptation strategy of the EU also, doesn't hide complexity, doesn't hide uncertainty. There is a path, we can see the different paths of the futures. We calculate the impacts that are likely attached to each of these paths. And this is presented with infographics, with very clear ways, clear narrative, so that it can be picked up. And this has been hugely successful because it makes all this rich data accessible, and that's so important. Another example I want to bring is a specific study done with the Commission and the World Bank on the financial and economic impact of risks, and an area that is sometimes not so much studied, but bringing these impacts, the future impacts, in another world, the world that in the end needs to finance all the risk reduction is very important. And formulating the same messages in terms of cost benefit. €1, our commissioner this morning mentioned this number, €1 invested in prevention can save €12 in future losses. Those messages are so strong, and they're based on the same open data, open information. So very, very important to continue with open data. We try at European level to place the risk data hub, the EU risk data hub, very central in all the research programs, and trying to attract the critical mass of this data, making it openly available for all researchers in this area. Over.
Thank you. I'm wanting to see whether there's any audience questions, and I'm not seeing very many at the moment. So I really do encourage the audience to ask our experts about this science policy interface and how it can be improved. In the meantime, let me go back to something that Beata mentioned, disinformation. We've all seen it during COVID. Julian, let me bring you back into the conversation. What did you note about disinformation during the pandemic, and what about the, climate change? Of course, the crisis that's going to be so much worse. What do you think the role is to try and stop this disinformation that can really jeopardize society's understanding and society's understanding of risks?
But I've been studying and working on disinformation for over 10 years now. And clearly the pandemic has changed everything. I used to work on small groups on the internet, people, small circles of people who had the same theories, September 11 never happened, and, stuff like that. And always linked to whether the far right or conspiracy expert that we knew and identified. But that was a small community. And with the pandemic, it went global. What was, the theories of a minority, now they went mainstream. There was a famous film documentary in France, which was called Hold Up, which was only financed by people on the internet, and it got, I think, more than 1.5 million views on YouTube, and people paid for it. They paid to view it, and it was full of disinformation. And that never happened in the past.
No, in fact, I'm not going to ask you what it was called, because I'm reinforcing the disinformation. So carry on, Julian.
Yeah, don't worry. That wouldn't be. They had 1 million views, so I think the damage is done. What I mean is that it went, I think, mainstream. And we'll have to take that into account, and the way we fought against it has to change, because obviously what was a small problem could be addressed by a small team of people, but what is now a huge problem needs to be addressed differently, and not only by journalists. And it's clearly something that the whole society has to tackle. the governments. I work with professors and teachers all over France, the civil society, scientists, of course, international organizations. I think we should all work together, that's for sure. And then for the climate change, I think it's totally different, because at least in France, I mean, there are very few people who actually say that climate change doesn't exist and it's not, human driven. I think in France, very few people would say that. I know that in the US and other parts of the world, there are still people who believe that, but in France, that's a very tiny minority, and I don't think that's an important issue. The problem we have in France is more the small fake news. Like, for example, that all climate change can be stopped with new technologies that are on the verge of being developed. And then that's a small fake news, because it's not entirely fake. There are new technologies to address this, but we know that there's no one technology that's going to save us all and save us from thinking about it and save us from actually working on it. And I think that's the main problem that we have to address. All these small fake news and false information that tell us, well, you don't need to do anything, because anyway, the problem will be solved. And there's no big change to make.
Julian, do you think then that there's a danger that the public might be lulled into thinking we don't have to do very much because there is technology, carbon capture, storage systems, and we don't have to change our behavior?
Well, it's not just a question of behavior, because obviously I think that it's not just our behavior as individuals that's going to change everything. And I don't think it's the science that's going to change everything. And we can't just rely on technology to change everything. It's going to be like the main fight for the new generation. And as fake news, this fight needs to be addressed on all fronts. And my role, my tiny role, will be to just debunk all the small fake news that make us think that it's gonna all fade away. That's the way I see it.
Interesting. Well, we've got a couple of audience questions that have come in. So I am going to ask you to answer a few of those. There's one from the Swiss Federal Office for Civil Protection saying, well, this session is about the science policy interface, but what about opening up the topic to science policy society interface? This is also because, yes, with the media, it'd be possible for science to directly reach society, is what the questioner is saying. So Jürgen, let me just throw that one to you. Of course, science and policy, very important, but ultimately it's about society. What do you think needs to be done? And if we're looking at how do we do things better for the climate emergency, any thoughts there?
I think Virginia was spot on talking about knowledge brokers, and also what Julian was saying about the role of journalists and the responsibility, actually, because certainly we are so many researchers and scientists, and only a fraction of us are probably good communicators. And whatever you communicate is a selected portion of the available knowledge. So for instance, tying it to Tom's strong advocacy for open data is very important. But we also know that people in general who are not trained or who are not interested enough, they won't go to open data sources, even if they exist. So I think it's a really, really big challenge. But of course, a high visibility of science in media and when important topics are discussed is very, very important. I also think that it's problematic if complex or wicked problems in society are becoming too politicized. We saw in some of the comparative studies of the pandemic response how depending on what kind of policy style different governments apply, and also what levels of political trust is in place, really matters for how the response played out. So you can distinguish between, for instance, a centralized response, a decentralized response, a centrifugal response, or a centripetal response. And most, a good example, I think, is who do you put in front of the TV camera? I know that the Swedish response was heavily debated, but it was a scientist. It was Anders Tegnell, head of public health in Sweden. He's a scientist, and he was always communicating the message. Politicians stepped aside. In our neighboring country, Norway, it was the opposite. It was, even though you think those countries are so similar, it was the politicians that stood in front of the cameras delivering the message. And of course, this does something to what is being said and then how people respond to that.
Interesting. I'd like to ask whether any of the other panelists, if you'd like to say anything about the importance of the science policy society interface, please just come across the line.
Yes, I would perhaps like to also pick up on that, because I think the challenge for climate change are very huge, are very important, and it's so important to keep to communicate the urgency of and the size of the challenge, which is difficult to communicate it also to society, to people. But every time a disaster happens, there is actually an opportunity to communicate about this, because a disaster often comes in the news and attracts interest. So it's an opportunity to also talk about prevention, adaptation in the future, topics that are much more complex. And this is something we should absolutely do. We should use this opportunity to talk about a bit more complex long-term issues there. Now, we run the Copernicus Emergency Management Service, which is the space service of the European Union, using the satellite data to very quickly respond to disasters. We're monitoring the La Palma volcano. There's many activations, but there's a very lively Twitter feed, for instance, on Copernicus, because it's always nice images, and it's people are just interested in following what's happening and understanding the response and this. So that is a very useful tool to then also talk about risk reduction and bringing the urgency of other topics to the attention of not only policymakers, but also society. So those are definitely things that are very important.
There's a question here about artificial intelligence. I don't know whether there's somebody who's an artificial intelligence expert. Can artificial intelligence policy be useful for content sharing, for sharing content of good information in the community, from the perspective of behavioral science? Okay, so that's the question. Artificial intelligence, does anybody want to talk about the role that might have in sharing good information with the community?
Yes, I would be quite...
Oh, I'm sorry, Virginia. It's because everybody appears in such small boxes here. I think I saw Beata, and then I'll go to you, Virginia.
Yes, thank you very much. I think that artificial intelligence, it's a very important issue when we take into the consideration cooperation between administrative and scientists. And I'm sure that, for example, using our tool, our system, global information system, and our prognostic models, we can give a very good information to society also, because what is important that we should to bring closer governmental administration with scientists. And for example, in Poland, as I mentioned before, there is a governmental crisis management team leading by the Prime Minister. And during this meeting, we take a decision, taking into the consideration advisory from our scientists and from our models. And these models are connected with artificial intelligence. So I think that this is a good connection and a good example of using new technology for, first of all, government, but also for to inform society.
Virginia, I can see you're nodding your head there. Please, your thoughts on artificial intelligence.
Well, if I could very briefly bring your previous question about the whole of society, the whole of government together with artificial intelligence. To me, the Sendai framework in its global target G, which looks very much at how we might do early warning, and very much as Beata has just been talking about, would be a really good way of using artificial intelligence to improve our early warning. But the most important thing we have from the behavioral aspects is if we warn, do people know what to do with it? Do they know what actions to take? And that's something that we need to reflect on and possibly do more on, but what an opportunity it is with this modern technology to try and engage further.
There's one question here from the audience that I'm going to direct at some of our speakers before I hand back to Marco, who's going to sum up. This is the question. It says, panelists have mentioned the ad hoc scientific committees which emerged with COVID-19 for advising political leaders. What lessons can we learn from this experience for improving DRR governance? So perhaps if I go to Tom, and then Beata, and then Virginia, and then Jürgen, before we hand over to Marco. So Tom, your thoughts on how can we improve governance?
Yes, very interesting question. And it is really about having the right dialogue in place and the right stakeholders in place. I bring it back to this institutionalization of the science policy interface, because what became clear in COVID was we did not have the right tables in place to have these dialogues, and much needed to be created. In disaster risk reduction, this process has been going on for quite a long time, and there's a lot of work that has happened on governance, on bringing the right people together. But I think there's definitely an addition to this that is related to this science policy interface, and to bring that scientists bring together people around the table. Now, I come back to the model of our Disaster Risk Management Knowledge Center, which is a science-driven initiative. We were initiating it, but we brought to the table 11 directorate generals within the Commission, 11 sectoral groups: climate, disasters, security, environment, health, etc., on the table, and we've had a thriving community, a very good dialogue that we keep alive, but also always from the scientific point of view, data-driven, knowledge-driven, to make knowledge flow in this community. And that is so important. That has been strong. After 5 years, it's still a strong group, even without formalization. But now this model has been taken and adopted by the member states. No? And under the legislation, there's a knowledge network that wants to follow a similar model, and we're discussing how to best do that.
Great.
Institutionalizing it is important.
I was just going to interrupt because I want to say to the others, please just give me one lesson to learn about improving DRR governance, because I want to leave enough time for Marco at the end to sum up. So Beata, one lesson for improving DRR governance, then to Virginia, then to Jürgen, and then to Marco.
Thank you very much. I think that participation of experts from the science in the activities planning conducted by the government is very key issue. And I think that it's highly recommended to involve scientists, as a support of implementation of Sendai framework. For example, through the development of the national and local strategy for disaster risk reduction.
Thank you very much for that concise answer to that question, Beata. Virginia.
So to me, governance is key. Everything we do must have a governance message. Everything must be clearly reported and owned. But part of that means a proper monitoring and evaluation to make sure that we're delivering the pieces that are needed. And our job has been very much to make sure that we only have those ad hoc committees where absolutely essential, and try to work with them to begin the initiating, management, and closing of them wherever we can through a governance mechanism.
Jürgen.
Yes, I want to bring in one factor that we have not touched upon, and that is the awareness of different time scales. So one thing that the pandemic taught us was that we were very keen listening on epidemiologists for the acute moment, what to do. But as the pandemic has moved on, we have seen a tremendous increase in domestic violence, in a decline in children's psychological health, such things. So when we talk, for instance, about climate change, we need to be very aware of the different timescales, short, mid-term, and long-term effects and consequences.
Well, thank you to all of our speakers and to our audience for their very informed questions. I'm going to hand back now to Marco Massabo from the CIMA Foundation. Marco, you have 3 minutes to sum that up. That really is an elevator pitch that Virginia was talking about later, but I know that also you're going to take some of the thoughts that have come into a document later. So Marco, please, I hand over to you for the last few minutes.
Thank you, Claire. I think it was a fantastic journey that we had in this session, bringing us to very many different aspects of the science and policy interface. This one reflects a lot what we was discussing also during the session organization team, where we have a large number of experts that brainstorm on the preparation of this session. And we have different vision, different angle from the science and policy and science society interface, and how we shape this one in practical terms. And all this discussion, I think, is very well reflected in here. But what will peak is definitely a lot of attention on the mechanism of the institutionalization of this science and policy that was brought by Jürgen with the experience from different countries, highlighted there is no one solution for all. Is Tom as well as brought the experience of JRC as an organization completely embedded in the political science, and Beata and Virginia as well, giving us a very broad picture on how many solutions we can have and depend on the context that we are working with. One other thing that I think is coming out very, very clearly is the partnership and the dialogue that should be based and established in the pace time, working together on a practical level, even on the terminology, listening each other. I think this one was a very fantastic example coming up from the different partnership. That brings to the communication challenge and the elevator pitch. That definitely is a very nice picture that we should keep in mind. But I like a lot also how Tom was saying that we can communicate the complexity and the uncertainty in this world that will be one of our challenge for the future, especially if we work with the climate change and the societal changes. We can communicate, and we don't need to give up and communicate the complexity and the uncertainty as well. The communication, of course, well, the misinformation, the backup of all fake news, this one is a very important part that is coming very clearly in this science and policy interface as well. The last point really, and then I will go on the messages, is on how the science responds to the policy needs. And we go from the practical level. We see that there are experiences in that. Beata was very clear and Tom as well on the knowledge broker, the making knowledge accessible in this, the open data and the complexity. But we need, I think, to have this perspective that science should be serving more the policy needed demands. So we start from the demands. So having this broader ecosystem of very different area, we thought with DRR that we can summarize this experience in a publication as word into actions. There are a series of guidelines based on the expertise at the global level, the community of practice, and trying to understand and share this experience on science and policy from Europe, but also from other regions. So that's a challenge that we are going to take to leverage on this knowledge to make sure that this experience are also available for other group. And this one, I think, is for me one of the good messages that also we can send, that we will try to condense, maybe in not a very in an elevator pitch, but something similar like this experience on how to improve science and policy interface. Thank you, Claire. Over to you.
Well, thank you, everybody, and to our audience. We wait with bated breath for that clear, concise, and compelling publication, Words into Action, on the topic of the science policy interface that Marco is talking about, and we do hope that will be published soon. Thank you very much for your attention this afternoon. I wish you all the best. Please stay safe. That's goodbye from all of us. Thank you.